Beginning is almost always difficult. That's why it is said that a good start is half the battle. This video focuses on beginning the role play. As a healthcare worker, you are going to begin the role play. So in this video, I'll try to explain you how to begin, what name should I use during the role play, should I ask the patient's name during the conversation, what name can I use, what if the name is difficult to pronounce. All of these questions will be answered into this video. This is Kirti from Kirti Institute. Stay tuned with me till the end. Okay, for all these three scenarios, you believe that you are in a private clinic. In the first scenario, a 45-year-old patient has presented with a 3-day history of fever. And the first task says that find out the reason for patient's visit. So understand that this patient is a kind of walk-in patient. You don't know who the patient is and what is the reason for this visit. So of course, you need to introduce yourself, get the introduction, and then ask the reason. You can say something like, "Good evening, my name is Kirti. I'm one of the registered nurses on duty today. May I know your name, please?" "Okay, Jay, how may I help you today?" Okay, let's understand the second scenario. A 45-year-old patient came yesterday with a 3-day history of fever. The patient underwent certain investigations and this is a follow-up visit. Your first task says that confirm the reason for patient's visit. And the bracket information says that to understand the results of the investigation. So now understand that this is a follow-up visit. Patient came to you yesterday and today patient is coming back to know the outcome of the result. And the first task says that confirm the reason for patient's visit. That means the visit is already pre-planned. Yes, it has been fixed in advance. So you know that, okay, this patient is going to visit me at 4 p.m. So probably you know the patient by name. And in this scenario, the background information says that you know the patient already. So of course, do you think you need to introduce yourself? Not at all. So you can ask the patient's name in advance during your preparation time. You may ask your interlocutor, "How may I address you during the role play?" And you can utilize the interlocutor's name during the conversation. Okay, so and confirm the reason for patient's visit. You are confirming. Okay, you are not asking, just confirming. So you may say something like, "Hello Jay, nice to see you again. Yesterday you came with a history of fever. We ran certain investigations and you are here to know the outcome of the results. Is that right?" Okay, so you are just confirming that, okay, this appointment has been planned for so and so reason. Okay, now in the third scenario, 45-year-old patient presented to you with a history of fever. Patient underwent certain investigations and based on your assessment, you have just informed the patient that he has typhoid fever. The patient seems anxious. Now understand that the first bullet point says that find out the reason for patient's anxiety. So in this case, the communication begins from the midway. Okay, this says that the introductions are already over. Okay, you have already introduced each other. Okay, you have already examined the patient and you have already informed that you have typhoid fever and you looked at the patient and patient seems anxious. So from this point, you need to start. Okay, so you may say something like, since I have informed you that you have a typhoid fever, you look a bit upset. Is there anything bothering you? Okay, so these were 3 different ways to begin your role play. The first scenario with unknown patient and you don't know the reason for the patient's visit, where you need to introduce yourself during the role play and you can also ask the patient's reason for the visit. In the second scenario, we have seen the patient is very well known to us, okay, and patient has come for knowing the result of the outcome, okay, of the investigations, and here you do not need to introduce yourself as the patient is already known to us. And in the third scenario, of course, you do not need to introduce yourself, but the beginning is from the midway. So you need to keep all these three things in your mind. If you see something that you have just done something, your the communication will begin from that point. Okay, I hope this video is useful to you to have a good starter with the OET role play. And if you wish to have one-on-one communication with me, or if you would like to have a small group batches learning, then please contact me on the numbers flashing on the screen. See you there.